Well, do you spend most of your day at a computer? If so, you could be at risk for developing carpal tunnel syndrome. And women, get this, we are 3 times more likely to get it over men. Well, in today's Wellness Wednesday report, we are talking with 2 therapists from Franciscan St. Health Outpatient Physical and Occupational Therapy, Sherry Bush and Stephanie Chagdis. Good morning, ladies.
Good morning.
Thanks for being here. Sherry, I want to start with you. Tell us exactly what carpal tunnel syndrome is and how it happens.
Well, it presents as numbness, tingling, and pain in the wrist and hand, primarily in the thumb, index, and middle fingers.
Okay.
And it's from compression on the median nerve, which passes through the wrist. Now, the carpal tunnel is made of carpal bones on the bottom, a band or a ligament across the top, and some tendons and a nerve that go through the middle in a very narrow space. So when someone does a lot of repetitive motion of the wrist or poor positioning on the keyboard or pressure to the palm, that causes swelling in this area, and then you get the numbness and the compression on the nerve.
Okay, well, Stephanie, tell us a little bit about carpal tunnel in the workplace and these incidents and how they happen.
Sure. Those who work in an office setting may be at increased risk for developing carpal tunnel syndrome.
We're like this all day on the computer.
Yes, repetitive typing, key entry is highly associated with missed work and injury due to carpal tunnel syndrome.
Okay, and what are some tips you think that we can use to prevent before it needs medical attention? Because it sounds like there's some easy things we could probably do, right?
Yes, there are, yeah. One would be to check your wrist position at the computer and your workstation. Many heights of keyboards can actually cause increased risk of tension in the wrist because of needing to bend your wrist in order to hit all the keys.
So we should be probably sitting up straight,
yes,
just like our mother told us to.
You can use a wrist pad that will help align your wrist in a neutral or straight position, and that can protect the median nerve. And research has shown that when the wrist is kept straight, there's actually the least amount of tension on the carpal tunnel.
Now, a lot of us probably feel like, oh wow, I know I've had numbness before, I've had tingling. You know, at what point do you need to seek medical attention? You want to take that one, Sherry?
Sure. At the very beginning, if you can do that, it's important to consult a medical doctor, because the sooner that you catch it, the better. And that prevents not only swelling, but also some scar tissue that can develop. So the earlier, the better.
Now, and real quickly, we're running out of time, but if someone came to you with carpal tunnel syndrome, is surgery the only option? Because that's, I know, kind of scary for people.
No. We definitely do conservative treatment. We get them a splint, either off-the-shelf splint or a custom splint that we make. We teach them specific exercises like tendon gliding that separates the tendons and nerves and prevents the compression.
Okay.
So,
wow, so a lot of options out there. So if you are somebody who works at a computer all day, especially for a long time, years, down the road, important to talk to your doctor.
Very important to talk to your doctor, and then you can ask your doctor for a referral to occupational therapy at St. Elizabeth, and we would be happy to see them.
Great. Well, thank you, ladies, for being here today. We appreciate it.
Thank you.